is a urinary bladder in front of you in the screen in transverse section, and as I move the probe quarterly, these are the seminal vesicles. These are the seminal vesicles posterior to the urinary bladder, and when I go more posterior, here we are going more broadly. This is the prostatic gland. Now the patient has presented with a history of dysuria. You can see that this is the prostate in transverse section, measuring 4.8 into 4.8 centimeters. Now there is a cystic area, this area seen at now the outer surface, if you see the periprostatic fat line is intact. Now this is a cystic area. At the peripheral zone, of the prostate, that measures 3.4 into 2.7 centimeters. So 3.4, 2.5 centimeters cystic area. This one seen at the peripheral area and the peripheral zone with tiny calcifications. These are calcification. This is a tiny calcification. This white line represents tiny calcification. Now this is what we have seen in the longitudinal section, and you can see there are a lot of marginal calcification. Now I'm going to move the probe 90 degrees to see it in longitudinal section. What do we see in the longitudinal section? If we get the same picture or not. Now here if you see, there is a cystic area. This is the 90-degree angle, and this is the cystic area. This is the prostatic urethra. It's clear. Now this is the cystic area, measuring again 26 by 1.26 by 15 millimeters, and you see that there is a lot of debris within it. Those marginal calcifications are also seen. So now this is again a transverse section of the prostate with another cystic area seen posterior left posterior lobe. This one. This is the first one, and now this is the second one. This is the first one, this is the second one, and this is the area. This is the cystic area. It measures 3.2 by 3.0 by 3.1 centimeter. It has internal echoes, dependent region debris, these fine sand-like particles, as well as internal calcification. This is a small calcification and marginal calcification. This is the outer surface of this focalium. So this is the echogenicity. This is marginal. This is internal. Seeing it in transverse section, and now in longitudinal section. This is the initial one, first one that we were seeing. This is the prostate. Now this area is the prostate. Prostate is within normal dimensions. The prostate is not enlarged. The periprostatic fat is intact. The urethra is okay, and this is the cystic area within the zone of the prostatic gland. All of this is prostate. Now all of this is prostate. This is the prostatic gland, and here lies the urinary bladder. Now the other one that is seen in the right posterior, in the left posterior lobe of the prostate in longitudinal. This is the initial one. Now this is the seminal vesicle in longitudinal section. Now let's get the other one in longitudinal section. Here we are with both of them being seen. However, this is more clearly seen. The larger one is more clearly seen in transverse section. This is where it is. So this is the focal lesion in the prostate with internal echoes. These are all echoes, internal or debris. Relatively thick wall. This is the wall. And with the internal calcification, these are the calcifications, and as well as marginal calcification and debris. Now this is a case of prostatic abscess, until unless proven otherwise, as I don't have any clinical examination notes, no prostatic exam notes, ER, and or any other laboratory investigations with me. The only complaint being dysuria by the patient, and patient being referred to perform the ultrasound of the abdomen and prostate. So this is what we saw. These are prostatic abscesses. One is in the peripheral zone, one is in the posterior zone. Both are sonographically consistent with being infective in nature, as we see internal and marginal calcification with internal debris, and the sonographic picture is very much consistent with two prostatic abscesses until unless proven otherwise. Thank you. This is the post-micturition of the study of the same patient, and the post-micturition residual volume is, this is the longitudinal section. Is 40 ml, up to 50 is considered normal. So here we see 40. So residual volume is within normal. Now with relatively empty urinary bladder, we can see that we can still see the cystic area. This is the one in the peripheral zone of the prostate, and the second one is posterior to it, and this is the second one, this area, and in itself the prostate is within normal dimensions. This is the outer periprostatic fat line is intact, Now this is the region of the prostate, area of the prostate in transverse section, and this is the prostate in longitudinal section with both cystic areas now being seen clearly along with the prostatic urethra. Let's do it again. Okay. Now this is the prostate with a normal dimension. I have magnified the view in fact. Now this is the prostate by itself, and these are the focal lesions in it. One is this, with marginal calcification, and this is the second one, posterior to it, this one. And one thing to note is that the prostatic urethra is spared by these focal lesions. That will be more clear in longitudinal section. You see this. This is the urinary bladder, and here is the prostatic urethra. There is no calculus in it. It's clear. And this is the anterior. This one is the anterior one, and this is the posterior focal lesion, the abscesses. Here you see the anterior, the posterior. So in this section we see that post-maturation residual volume is within normal. There is no urinary bladder outlet obstruction. Urinary bladder is clear. Periprostatic fat is intact. The prostate is intact. There are two focal lesions seen with marginal internal calcification and debris consistent with abscesses in the normal sized prostate. Thank you.